Hi, how are you? Joshua Youngs with Medicare Peace of Mind. Today I'm going to talk about what the annual enrollment period, or AEP, is for. The spirit of it is the plans. So your plan that you're on now, whatever you have for your prescriptions, or if you're on a Medicare Advantage plan, those plans change every year. Some kind of changes happen, whether it's benefit changes, copay changes, doctor network changes. There's a litany of different changes that happen every year. And so it's important to have someone that you can trust to help you compare and evaluate all of your options every year. And so during the annual enrollment period, you can submit literally one application a week with a different carrier. Last application in on December 8th, 12:01 a.m. is the one that sticks for January 1st. And so it's important if you want to have your coverage start. I hear it every year. Someone doesn't pay attention, someone doesn't get the right attention they need, don't reevaluate. Next thing you know, the prescription that's been covered, no problem, by your plan year after year, is all of a sudden no longer covered anymore. So situations like that can be avoided if you do a simple annual reevaluation of your options. At very minimum, you should evaluate your prescription side of your equation. That has the potential to have one of the highest exposure points there are, and so it's very, very important for you to reevaluate your prescriptions as well as the rest of your plan to make sure that there's no copays that have gone out of whack, your doctors are still within the plan and accept the plan, and things function the way that you want them to. And so no plan is perfect. There's no such thing. There's strengths and weaknesses to each one. And again, the annual enrollment period is designed for you to be able to evaluate all options and make as many changes as necessary, because we've all probably fallen prey to either the commercials on TV or the phone calls or other things. Somebody talks to you very quickly and smoothly. Next thing you know, you're enrolled in a plan. You're not quite sure what it is. You haven't seen any documentation, that kind of stuff. So it allows you, it's the only, annual enrollment period is the only multiple selection election period. What that means is most other election periods, once you've utilized the election period, it's been processed, it's in force, the election period's been used, you can no longer use it again. Annual enrollment period, you can theoretically submit application after application all through the enrollment period. The only exception to that would be on the same day. If you were to submit two of them on the same day, it does go to the first one submitted that day. And so if you talked to Agent A with Company A at 8 a.m. and did an application, then you saw another commercial later and said, hey, I want this benefit, and called Company B and did another application with Company B, the Company B application would not be processed. It would be rejected by the Center for Medicare and Medicaid Services. The first application in on that day would win. That's the only exception. Every other time, you submit an app on Monday for Company A and an app on Friday for Company B. The Company B app on Friday will be the one that goes in force, assuming that you do not submit another application prior to December 7th at 11:59 p.m. And so it's very important to find someone, if you don't already, that you can trust to evaluate these options for you. They change so much every year. Drugs can change what tier they're on. They can be covered one year, not covered the next. All of a sudden they can have new authorizations in place that you have to get. It's really important. Annual enrollment period is designed to give you the opportunity to make sure that you have the right coverage in place starting for January 1st. Thank you for your time. Have a wonderful day.